loop, so I didn't think it would be like these giant things hanging off, but it was. And so the cool thing about the surgery too is that in the older days, and I think even sometimes now, in order to do this surgery, they have to like stop the heart, because otherwise the heart's like beating and it's like shaking the whole time. And I mean, I'm sure that's pretty scary for anyone trying to do surgery on the heart, you know, because it just keeps jiggling. But so they usually stop it so you can work on it. But this surgeon, they did what they call off-pump CABG surgery, where they left the heart beating, and they would take this like tool, and it looked like a pitchfork. So Sydney, make like a V, like a pitchfork, or not a pitchfork, a tuning fork. Sorry, like this, right? Right?
Like Asian thing.
Yeah, super Asian, right? And then they would and it had little suction things on the bottom, and they would put it right around the vessel they were trying to work on, and suction it so that while the heart was still beating, the part where they were working on would stand still. So it was like that. And then they could work on this part because it was being held still, which was really cool, because I'm sure there's complications. I don't know them off the top of my head, but I'm sure there's complications when you stop a patient's heart to work on it. So that was really neat. And it was really cool for me to see whenever the heart is actually surrounded by a sac. It's called the pericardial sac. Peri meaning
Around.
and cardio meaning
Heart.
There we go. Pericardial sac. And so whenever we got there, it's like this thin film almost, and so you could see the heart moving underneath, and I was freaking out. I was like, this is the most awesome thing I've ever seen in my entire life. And then I cut open the sac, and this guy's heart was right in front of me, and it was just amazing, and it was a really cool experience. And surgeon, bless his heart, he was explaining to me what the right atrium and the right ventricle was, because, you know, I mean, pharmacy, you don't typically think that we would know much about anatomy, but anatomy and physiology is actually a very big part of the curriculum at Still Cops. So, and I guess I didn't tell him I'd been a TA for, anatomy lab TA for 4 years? 4 years, 8 semesters. So, you know, he was just trying to be nice. But it was just really cool to actually see it in person, to actually see a person's heart that was beating and connected in his body, and to see all the work they did on it. And I'm not sure if I could ever eat a Cheeto again. I mean, I ate like 4 cookies this morning.
I never
But,
liked
you know, I went for a hike yesterday morning, so I'm sure that makes up for it, I hope. But anyway, so yeah, that's kind of what happens. That's how we take care of a patient if we feel like their vessels that are feeding their heart are getting too blocked, because we don't want them to be completely blocked, or else the tissue dies because it's not getting any blood. So yeah, that's how we deal with it. Oh, and in this particular patient, they did Doppler ultrasounds. So, you know, like whenever you're pregnant, they do ultrasounds. They did an ultrasound around the heart to make sure that the parts of the heart that we were trying to deliver blood to through the surgery was really getting there. And it was really cool to compare the before and after ultrasounds to see, because the before ultrasounds, you could tell there wasn't a lot of movement in the muscle because it wasn't getting enough blood, it wasn't working well. It was very ischemic, which means what? What does ischemic mean? That means that the blood flow was being cut off, it was losing oxygen and things like that. But after we reconnected the vessel, they checked the vessel to make sure that there's actually blood flowing from the aorta through the vessel down to the rest of the vessel. And after ultrasound, you could see clear differences where the muscle was picking up speed and starting to function better. And that was really cool to be able to see and just realize that this little thing that I saw happen in front of me wasn't just oh hey, let's see what happens when we connect these two vessels together. It actually makes a difference. So yeah, and then on the pharmacy side, obviously there's a lot of things in the surgery that we have to worry about, like anesthesiology was there, and they use a lot of Diprivan or propofol to put the patient out. And then in this particular case, this patient had some complications, so his blood pressure was dropping, and we had to give him some epinephrine to get his blood pressure up, or else if his blood pressure dropped too low, we could lose him. And it was really neat to see the pharmacy side of it, I think, and to watch that. And then there are a lot of medications that this patient was going to have to be on once he got out of the surgery, which I was thinking about going into, but it might be a little long and complex to talk about. But I just wanted to share the surgery with you guys because I think the surgery in itself was awesome beyond awesome and really cool to understand and be able to see and put together. But yeah. Do you have any questions, Cindy?
No, I don't. I still don't know my purpose in this video.
Sydney was just my helper and a pretty face.
She forced me to do this.
I wouldn't say force.
You forced me.
I wouldn't say force. But anyway, I hope you guys enjoyed anyway. And if you see Cindy, Cindy's a third year. Well, she's finishing up her third year.
I'll be a fourth year.
So she'll be a fourth year. So I'm sure you'll see her on campus for at least the next 2 years. You can totally harass her. It's fine. I did it all the time. But she's a good sport. And so she still teaches anatomy lab. You're still going to teach anatomy lab next year, right? She's really good. And I don't just say that because I taught her, but she legitimately is good. And so if you're going to be in anatomy, open lab and coming to lab itself is really important. And Cindy can totally help you. And it makes a difference. And who teaches you makes a difference. Although all the TAs are good. I will definitely say that. But yeah, so she'll be here. And that's why she's in this video, right?
I actually don't know why I'm in this video.
Okay, anyway. But I hope you guys are having a good week.
Bye.
Or had a good week. Yeah, this will go up at the end of the week. So I hope you guys had a good week and that you guys are studying for finals. But I guess we'll talk to you later. Or I'll talk to you later. She might not talk to you later.
Yes, I'm going to be studying for finals too.
Okay, bye.
Bye.